When it comes to glycemic surveillance, does the hemoglobin A1C test provide enough information to accurately determine the level of glycemic control? We asked these leading doctors and educators that question.
I believe that we are too dependent on hemoglobin A1C, mainly because it is an average, and you can hide a lot of glycemic variability within an average. We could miss fluctuations from 50s to 300s and still tell the patient that they have good control. And I believe that that's a short-sighted way to have surveillance on diabetes.
People can have an A1C of 7 and be running very high after meals and then crashing during the night or during the day, and huge blood sugar fluctuations. That's not captured by the hemoglobin A1C.
Nearly 40% of patients considered in good control of their diabetes may suffer significant glucose variability because it reflects a 2 to 3 month average. A1C cannot specifically identify recent glycemic excursions.
If I look at a patient's log at noon on one day and it's 350, and on the next day it's 75, that's a big problem. And so I use this particular test, the GlycoMark, to explain to patients, look, you have these fluctuations during the day, which the body does not like, and not only do you have these fluctuations, but you have no clear pattern. And so I use it as an educational tool to get patients to recognize that it's important not only to have a good 3-month report card, but to have a day-to-day report card.
The GlycoMark test is the only test that is a specific indicator of recent hyperglycemic excursions, which can occur in the fasting or post-meal period.
And if you look at traditionally what we've used, it's been the hemoglobin A1C. However, as any average will tell you, that's a late marker because it is hiding all the fluctuations leading up to that. So if we look at what is one of the earliest markers of glycemic dysregulation, it's the postprandial excursions. So the hyperglycemia you get after eating. Most patients don't check their postprandials. Most patients are not on a continuous glucose monitor. So this test, the GlycoMark, allows us to drill down a little bit on the management in a postprandial time frame. And I think that's key for identifying early dysregulation of glucose.
The hemoglobin A1C does not tell what that glucose profile actually looked like. And so there are many patients, especially patients who are frankly getting bored with their A1Cs not changing much, that I add a little spice to their lives. I measure the 15-AG. They read about it on the glycomark.com website, which I give to everybody, and then they want to have it measured again because they have another goal of therapy that they didn't have before.
The A1C is really not the end-all, be-all in looking at the overall glycemic control of the patient.
Despite the important utility of the A1C, there are other factors that interfere with the A1C's ability to accurately reflect glycemic control.
We went and we looked to see how many of these patients did the hemoglobin A1C not reflect their glycemic history. And we were surprised at the time to find out that it was about 14% of patients. This was a few years ago. And since then, that list of things that alter hemoglobin A1C has grown, and I actually think that list is actually larger than the 14%. I think it's important for both patients and clinicians to always ask the question, is my hemoglobin A1C reflecting what is actually happening with my blood glucose? And we have different ways that we do that.
Also, heart conditions, anemia, and other factors can shorten the life of red blood cells, which can lower the A1C result. This means that the A1C result could be missing important hyperglycemic excursions, suggesting that the patient has better glycemic control than they actually have. GlycoMark isn't a replacement for A1C. It connects the dots on the patient's roadmap to glycemic control.
I order it all the time. Along with my hemoglobin A1Cs, to be sure that they're not peaking too high or staying too high too long.
I always look at hemoglobin A1C and GlycoMark as a team.
It's reflecting what their control has been over the last 3 months, along with the hemoglobin A1C as a confirmatory test.
And so all of them are components of the overall surveillance.
Glycomark. It's what you don't know.